It is actually the one of the probably largest, or I can even say the only international congress on this topic on oncology acupuncture. So it is very unique that we are all gathering here with the interest to learn more specifically on treating oncology patients. So, dear colleagues and distinguished speakers that will come along, we have a very interesting and exciting lineup of speakers and discussions. And thank you, our wonderful global audience. This year, our theme is 360 Oncology Acupuncture. It's a vision that reflects that our commitment or to see the patients, the practitioner, the science, the tradition, and in all of their perspective. For me, oncology acupuncture is not just a profession, it's a mission. It is a personal path, starting from weekly treating dozens of patients to doing research to teaching. But my inspiration always starts from the clinic and from seeing how patients are benefiting on a daily basis from our medicine. And to me, this is one of the greatest needs and opportunities to put Chinese medicine and acupuncture into the mainstream or into the integrating it into cancer care. I want to sincerely thank to Guy, you just saw, Guy Treiber from the TCM Academy. Hi Guy, thank you for working so hard, and Patty on this Congress. You know, every Congress has weeks and hundreds of emails to organize it all, that it will happen and run smoothly. So thank you for your commitments and inspiration and being here for all of us. I want to thank our speakers who bring both their clinical experience, academical excellence, and with open hearts to share and give from their wealth of experience. And we are here because we believe that acupuncture and traditional medicine are not an alternative, but essential partner in the future of oncology care and even the present. This symposium is a bridge between the ancient wisdom and modern research. It is a bridge between the clinical application of acupuncture and the scientific evidence, as well as the ancient knowledge that will be explored here. Because the world needs what we have, and because cancer care needs healing, not just simple treatments. And because together we can make a difference in the lives of those that most need it. And this is really a cancer patient, whether that presently are having treatments or had cancer, and we can help them to recover and potentially also to prevent the recurrence. So thank you all for joining. Thank you all for being part of this circle. And without further ado, I would like to introduce our first speaker, Dr. Libin Jia. I must say, I personally followed and watched Libin Jia work in the NCI and being part of the SIO, the Society of Integrative Oncology. And I'm delighted that he found the time to join us here. Dr. Libin Jia is a physician and researcher with a distinguished career in the US National Institute of Health. He served as a scientific program director at the Office of Cancer Complementary and Alternative Medicine within the National Cancer Institute, the NCI, where he helped establish key research collaboration in integrative oncology, mutual anti-cancer components, and integrative medicine from COVID-19 care. Earlier, Dr. Jia worked with the Office of Cancer Genomic at the NCI. It's quite a different career, although not so different. And he was part of a anatomy project. Now you have to correct me on this. The mammalian gene collection and the H invitational human genome annotation project. So he worked very deeply on both genome project and then moved to work in the Office of Integrative Medicine. And I must say the NCI and the NIH strongly support us. I don't think there is a country where the National Health Institute is so involved and gives funds to research in acupuncture in oncology as the NCI and the NIH and the NCI and the office that Dr. Jia was part of. His work has consistently bridged molecular science, integrative approach, and global collaboration in cancer research. So again, without further ado, Dr. Libin Jia, it's my honor to introduce you, and the floor is yours.
Thank you so much, Dr. Memo, for your introduction. Okay, thank you for the Symposium Organization Committee invitation, especially Dr. Ye Memo's kind invitation. I'm honored and be very happy to give you some information regarding the current status in acupuncture research. I'm Libin Jia, as Dr. Mamon introduced. I'm a former program director. Right now, I'm a special volunteer still working for NCI. Some of my view may not represent the NCI. Here, I just give you some introduction in terms of through my study regarding the current status and developments in acupuncture research. First, as you see, the methodologies in acupuncture research definitely is very important. So the randomized, the controlled trials, in clinical trial is considered as a golden standard. Now you see more and more RCT trials in acupuncture study or applications. Then our systematic reviews and meta-analysis, that's very now common or popular to do large data analysis, try to get a more outcomes out. Then qualitative research approaches also is used for acupuncture study. In terms of mechanism of action of acupuncture, so mainly people are focusing on neurological mechanisms and psychological responses and effects of acupuncture. I will touch base for all these areas, but not expand it too much. So for the clinical applications of acupuncture, definitely this is an important area. Lots of you are practitioner. So I listed a few of them. For example, the pain management by acupuncture for like a low back pain, also like a dental pain, and all these, the control acupuncture definitely can play some role. On the mental health disorders, acupuncture applied to anxiety and fatigue and so on and so forth. Then chronic conditions like acupuncture application can slow down the multiple sclerosis progress, and also applied to asthma and like a shoulder pain, just give you an example. And also on the post-operative or even, pre-operative, surgery or recovery. So acupuncture application already used. For example, the like a tonsillectomy pain after the surgery, acupuncture definitely has been applied. And also to reduce the nausea, vomiting after the general anesthesia and for the surgery, acupuncture also plays some role. Then here you also could see on the right the acupuncture in the pediatric care. Now we see some studies and there's some trending. For example, the acupuncture treatment for children with cerebral palsy, CP, you see some improvements in the function of the cerebrum. And also for pediatric, rehabilitation, acupuncture also used in the area. So in acupuncture and women's health, definitely there are some applications and studies on the menstrual disorders, fertility treatments, even though there are some, controversial, but people are doing the study in the area. And also pregnancy and labor acupuncture used in this area. Then for the acupuncture for addiction, or like a drug addiction treatment, we see there are some researches on the neurological mechanisms. Then integrative approaches of acupuncture, then try to see the acupuncture and Western medicine. Then. And also in the area of like cultural perspectives, acupuncture, Eastern and Western perspectives, lots of you are familiar with this area. And also we see more in the public and conventional medicine practitioners, they are, in some degree, accept the acupuncture treatments, also in oncological area. For the challenges in acupuncture research, standardization of techniques definitely is area, even though, acupuncture originally, Chinese medicine emphasize, the individualized, but still in some way you can do some study. The placebo effects considerations is an area, lots of basic researchers try to study in this area. And also for funding and publication bias, some countries, some regions, there's some funding only for results with positive results. So also we do see some publication, has some certain degree of bias, but we just may need to be more careful. For the future direction of acupuncture research, we will see some emerging technologies, for example, AI and some technology database used for acupuncture research, and also interdisciplinary collaboration and global health perspectives. Then other areas, touch a few of them, because of the time limitation. For example, the patient safety and adverse effects is important. And also the training and certification of acupuncturists. You need to guarantee the quality in the qualification of these acupuncturists, not only just to get a certificate, but their real clinical practice needed to be evaluated. So in acupuncture and the immune system, that's a very hot area, and also some comparative effectiveness of acupuncture. These are area people are doing the study. Here, I quickly just give you some general view about the acupuncture. I think most of you are familiar with the definition of history. Acupuncture is an ancient traditional Chinese medicine practice involving the insertion of various thin needles at specific points on the body aimed at restoring balance of virtue and energy. Usually they call it qi, to promote the healing and relieve pain. Then now widely integrated and studied within both Eastern and Western medical systems. So as most of you knew, the acupuncture originated in China over 2,000 years ago. Then documentary extensively in classical texts like the Yellow Emperor's Classical of Internal Medicine. So it is rooted in the philosophy of yin and yang, two complementary forces whose balance maintains health. Disease is viewed as an imbalance of these forces or an abstraction of qi, the body of virtual life energy flowing through channels called meridians. By stimulating specific acupuncture points on these meridians, practitioners seek to restore harmonious qi flow, and thus health. But I'm from NCI. I recommend you take a look about the called Physician Data Query, the PDQ, on the definition of acupuncture. So, since most of you are professionals, so I recommend to view the professional version. So you can see the cancer information summary. So on this PDQ on the acupuncture, it says the use of acupuncture as a treatment for individuals with cancer or cancer-related disorders. So they listed, these kind of summary information below. So it's a part of traditional Chinese medicine, and also define the application of simulation, such as needling, moxibustion, cupping, and acupressure on specific sites of the body, known as the acupuncture points. So here's the very important point. The US FDA approved the acupuncture needles as a medical device in 1996. So this is important milestone. So acupuncture widely used for the illness and the ailments. Cancer patients use it for pain management, control of nausea, vomiting, fatigue, hot flash, xerostomia, and neuropathy, and anxiety, and depression, and so on and so forth. Then the laboratory animal studies explore the mechanism, especially the immunomodulation of acupuncture. Then most of the acupuncture clinical observational trials in cancer patients has been evaluated the effects of acupuncture on symptom management. The most convincing research data on the effects of acupuncture in cancer patients have emerged from the study of the management of chemotherapy-induced nausea vomiting. Here I quickly give you some idea. So I did some meta search. So you can see the earliest data record or reference on acupuncture was published almost 200 years ago in 1827. Then, for almost a century, over a century, so the reference in acupuncture only maintain, very low, number. But currently, until 2025 or 2026, so we already see over the 50,000, reference related with acupuncture. Then here, just to show you the first, I found the record of acupuncture is from a journal called Medical Chirurgical Transaction, which was published in 1827. So it, mentioned, to use some the observations on the use of acupuncture in the rheumatism. Then there's something happened, in 1971. So here I cite, from an article published by James Reston, who actually is a member from a delegation led by Secretary Henry Kissinger, who visited China before President Nixon visited China in 1972. So in 1971, so when this New York Times journalist James Reston, he visited Beijing, he had the acute attack of appendicitis and had to undergo an emergency appendectomy at Beijing Imperial Anti-Imperialist hospital at that time. It's named called. So after that operation, Chinese doctors treated Reston's post-operative pain with acupuncture. So Reston was so impressed, as he said, at the pain relief acupuncture gave him, and he wrote about it in his New York Times article called "Now, about my operation in Peking." So his paper was a hit. And since then, most American started, hear the acupuncture, spring, their curiosity. Then here I put it here, from 1827 until 1972, all this maintained like a single or two digits publication on acupuncture. But in 1972, you can see the jump. So here is the table you can see from 1827 to the 2025 for almost 200 years. So you can see before middle of in this region 1827 to middle of 1940s. So they pretty much maintain only single digit or one publication. Then since middle 1940s, you can see 2 digits increase. Then until the President Nixon visited China, you can see this year, 1972, so the publication jumped to 99. Then afterwards, there are 3 digits. Then you can see the increase until 2007. 2008 reached 4 digits. Then the 2024, you can see the reference, you can search on PubMed related with acupuncture is reached over 4,000. So we're really happy to see so many publications related to acupuncture. So this is the you can see the increase so high. No. Then I give you a brief overview about the licensed acupuncturists on the domain graphics and statistics in the US. This is based upon a think tank called Zipia. They did lots of research. They're using 30 million profiles. So then compare some other database like a Bureau Label Statistics and Census and the current job, licensed acupuncturists after extensive research. Here, what they have found. So there are over 6,438 licensed acupuncturists. This was I searched last week. So currently employed by the US, they are licensed. 65.1% of all licensed acupuncturists are women. So while 34.9% are men. So average licensed acupuncturists, their age is around 50-year-old. So most common ethnic, of licensed acupuncturists, is white. Then followed by Asia and also Hispanic and Latino and some others. Then here I quickly give you some U.S. government policy regarding the coverage of health insurance. So in January 21, 2020, U.S. the Center for Medicare and Medicaid Services. So they said they will cover acupuncture for Medicare patients with chronic low back pain for 12 visits within 3 months. Of course, if the purpose of this decision, so we're defined as, so they last 12 weeks or longer, so the patients have the low back pain, and also non-specific or not that identifiable system cause of the low back pain, or not associated with the surgery or not associated with the pregnancy. So for maximum, they can reach to 20 acupuncture treatments for low back pain within a year. It's covered by the insurance. So that's good news. Then also, NCI designated cancer comprehensive cancer center. You can see this is a paper by Dr. Mao and other colleagues. They found so the 51 NCI designated comprehensive cancer center. There's 39 centers, NCI designated centers. They have acupuncture, research and services. So very high, over 76%. Then here I just quickly give you an overview about the French Henderson Cancer Center. They supports research into the barriers of implementing acupuncture and offers the therapy to patients. And also University of Maryland Comprehensive Cancer Center provides an on-site acupuncture clinical specifically for managing cancer treatment side effects. Sloan Kettering Memorial Sloan Kettering Cancer Center, they offer also the acupuncture and a database of evidence-based information complementary therapies. Dana-Farber Cancer Institute definitely has oncology acupuncture team led by researchers who investigate the therapy's benefits, and also Roswell Park Comprehensive Cancer Center. So it offers acupuncture to help patients manage treatment and side effects. Just to give you a few example. NCI, sponsored and give fund on the acupuncture research. Here I give you example. For found the principal investigator, Dr. Hirschman in Columbia University. So she did a research on effect of acupuncture versus sham acupuncture or waitlist control on joint pain related with aromatase inhibitors among women with early stage breast cancer, a randomized clinical trial. So the question they asked was, does acupuncture reduce the joint pain related to aromatase inhibitor among post-menopause women with early stage breast cancer? So they recruited 226 women with early stage breast cancer. Patients, in acupuncture treatment group compared to the those in sham acupuncture group or the waitlist control group had a significant, reductions in changes in joint pain scores from baseline to 6 weeks. So they concluded acupuncture was associated with statistically significant reduction in aromatase inhibitor related with joint pain at 6 weeks. And also, not only NCI, I give the example just now, in the National Center for Complementary and Integrative Health, NCCIH has actively funded acupuncture research through various funding opportunities. So recently, this center participate with Agency of Health Research Quality and the Center for Medicare and Medicaid Services. They are seeking acupuncturists for a randomized control trial to evaluate the impact of acupuncture treatment on old adults with chronic low back pain. So this initiative is part of the Helping to End Addiction Long-Term HEAL initiative to address the opioid public health crisis. So for the detailed information, you can search their website. Here also I give you quick information regarding a workshop our office and the NCCIH organized in 2019 on the translating fundamental science acupuncture into clinical practice for cancer symptom management, pain, and substance abuse. So all the most of the speeches collected in medical acupuncture in this special edition published in December 2020. So they touch base with the mechanisms of intervention of acupuncture. Study relatively new field oncological acupuncture defined and explanation of how it can be incorporated into precision medicine, and also find some models. Several potential mechanisms of action are explored, including effects of epigenetic mechanisms. So quickly give you the information after the publishing of this special edition. So in 2020, so the first month, the full text downloads reached 5,516 times. And the journal was very happy. So up to the end of 2021, so the full text downloads 16,616. So you can see the journal was really happy. You can around $50 to download this. So how much they make. Yeah, that's really good. We're happy. Here I just quickly just give you the idea, the two journal. We published including Dr. Mammon, one of the authors. So in this year, volume 37, issue 1, issue 2, regarding the global perspective on the acupuncture, education. So acupuncture education experts from US, UK, Israel, China, Iceland, Brazil, Australia, Malaysia. So discuss the current development of acupuncture education, including spatial model, teaching quality evaluation system, AI and database application, combination of online demonstration and clinical practices. Here I just quickly give you overview and about the area. people are interested in to do the acupuncture study, and also the history quickly, and also the NCI PDQ definition, then some reference, and also the other information related to the special edition. Thank you very much for attention, and thank you for your participating. Thank you.
Thank you. Thank you, Dr. Jia. It has been enlightening and interesting, and I think should be well noted that both the statistics of the growing research and in the same time, all the major medical hospitals in the US are employing acupuncture and doing a lot of research, and hopefully the rest of the world follows. As I say, we are very active in Europe, and we hope to see more and more of the statistics growing. So it is very encouraging to me. We should be in all hospitals everywhere that there is cancer care, and hopefully we can show growth maybe next year. So thank you very much for joining us and taking the time to share this information.
Thank you so
Thank you,
much.
Dr. Jia.